They're the people we hope never to need, but when an emergency occurs, they're all we depend on.
Ambulance emergency.
Okay, tell me exactly what happened.
Don't do anything for the meantime and put the knife away.
Filming with 999 call takers, emergency paramedics and their patients. This is the story of the men and women of the HSE National Ambulance Service.
I don't know everyone in Wicklow just because I live in Wicklow.
You feel a bit dizzy. Sit down there before you fall down because I won't be able to catch you.
This time, from the unusual to the unpredictable, how ambulance crews across the country cope when faced with a medical emergency.
These guys are lucky that at the time of the call we're available. If we're not available, they're in big trouble.
You're in an ambulance. We're paramedics with the ambulance service, okay? And we're here to help, all right?
To the calls for help in a life-changing crisis.
Okay, calm down there now because I need to know exactly where you are.
Yeah, I'm trying to ring them back. He was shouting in the background saying he's going to cut her face, so...
And how a stark increase in drug-related emergencies can put even the most experienced of paramedics on edge.
Listen, your hand is bleeding.
For many, today will be like any other. But for some, a traumatic or life-threatening medical emergency is about to occur. And a single 999 call will begin a chain of events that will dispatch 24-hour frontline paramedic crews in cities and towns across the country.
The role of the paramedic is answering 999 calls that are allocated to us by the control centre. They range in seriousness.
A HSE paramedic can be a very challenging job from time to time. It's a very rewarding job most of the time.
My job sort of extends throughout the scope, be it treating the most minor of injuries to treating the most serious of injuries that we deal with pre-hospitally.
On a daily basis or nightly basis, we can be called to basically everything and anything from car crashes, respiratory problems, medical conditions, cardiac arrest.
We get to go to people in the worst time in their life, the absolute worst time. They're either having a heart attack or they're in a cardiac arrest and their family members are panicking in the house, obviously, or they're having a baby. And obviously the back of an ambulance is not what you plan when you decide to have a baby. But sometimes fate steps in and we're the ones that they see and we're the ones that welcome baby into the world, and you know, and you get to do that and you get to see that side of things that normal people don't get to see.
I suppose a paramedic's job is going out and helping people. It's not always about doing interventions on people. Sometimes it can be a reassuring smile. It can be just being there for somebody and listening sometimes. And sometimes it is about the big skills or the trauma we see and bringing big interventions and drugs and therapies. But most of the time it's about reassurance and connecting with the person.
All in all, it's a very rewarding job.
Cork is good. Cork City's busy station, lots of medical, lots of trauma calls, great bunch of people to work with, lots of different characters, you know, so you have the quiet people and the funny people and the real intense people, so, but they're a great bunch of people. We all look out for each other here and it's a really good station to work in.
When we receive a 999 call, we can either be at the base or we can actually be in the vehicle. If you're at the base, you just make your way to the vehicle, you go mobile on the call. En route, then you will get your directions where the call is and you'll get a general idea of what the call is. So you can be prepared or preparing in your own head of what you're going to deal with when you get to the scene.
It's a 35-year-old man, lips turning blue.
Roger, thanks. I'll receive, thanks. So we had a call to the Grand Parade for a chap, collapsed. We got down there. It was our usual spot where we pick up an awful lot of heroin users. This fella?
Sorry.
Ah, yeah. He's not too bad, son.
No.
Super.
the phone call had been made by 2 girls that were passing by and had found him on the ground. When we heard the address, we assumed that was what it was going to be, was a heroin OD, because it would be a very prevalent area for the heroin in the city.
You alright? Yes, sir. Alright, I'm going to get you up and moving to the ambulance, alright? Get you up onto the bed, alright? Yeah? Yeah, you do. You need to pop in. Just stay chatting there for a second till we take a look at the sats and things on you and your pulses and all that.
When we got there, this gentleman was barely breathing. We gave him the drug to reverse the effects.
We can give them a drug we carry called Narcan. And Narcan, it doesn't reverse the effects, it just blocks the effects that heroin has in the body, and it increases the respiratory drive again.
And he came round and he actually physically got up with us and walked into the ambulance. No, come up here, up the steps. Come on.
Yeah, up you go.
Are you listening?
Up the step with me, that's it.
Come on.
There we go. We got him on the stretcher and he was barely breathing. The drug was starting to wear off again and he wasn't breathing that well.
Where did you inject it? In your leg. Where in your leg?
Got him into the ambulance and we had to keep kind of calling him because anytime we didn't actually call him, he wouldn't take a breath. So the more we call him, he'd actually take a breath again, and then we'd be busy doing something and you'd have to kind of remember yourself to go, Tony or Brian, and he'd take a breath again. And that's how we were keeping him actually breathing initially. His respiratory drive was getting less and less, so we popped in IV access into him. We had given him one intramuscularly already, we gave him the second one IV, and the hassle with giving this drug IV is that it reverses the effects a bit quicker than it does intramuscularly.
Alright, good man. We're going to bring you to the Mercy Hospital. Yeah, we are. There's 2 boys in blue up there, isn't there? You asked them to come down here.
You've on the seatbelt.
It's rarely you get a really bad reaction from somebody. They might be upset and they might give out to you a little bit, but it's rare that they get kind of upset and violent and jump up and get aggressive with you. But that's what happened with this chap.
Let us take our bits off you and then you can go.
Sure, do it,
Right,
man.
just relax 1 sec. Just go and pop out now. 1 second. 1 second, 1 second.
He jumped up, he started to get aggressive. He pulled out the IV we had in his arm.
Your hand is going to bleed. Right, 1 second.
We now had the risk of blood exposure as well, because he was waving his hand around the place with blood dripping off his arm.
Listen, your hand is bleeding. You're bleeding.
Hang on a second. You were inside the toilets. You weren't even breathing when we got you. Okay? There was no reasoning with the gentleman.
Let us put a bandage in your hand.
Have some bit of appreciation of what we're doing.
And I'm trying to explain to him all we want to do is dress his hand, and he can go if he wants to. We can't stop him from going. We're not guards. I'm not going to sit on a fella in an ambulance if he doesn't want to come to hospital with us. I can't do that. All we want to do was dress his arm and get him sorted so that he can get out of the ambulance, but he was having none of it.
Let us just put a bandage in your hand. Look at your hand is bleeding.
I appreciate your time, man.
Right, go on.
I appreciate your
Alright,
time.
go on.
He's going to bleed out.
Yeah.
You can't forcibly keep them in the ambulance, because at that stage they are fully with it. They're capable of looking after themselves at that stage.
Our concern is if this guy jumps out of the ambulance and runs away, and then he's found 3 or 4 hours later dead in an alleyway. I don't want to be going home not like that. I haven't done as much as I can for this chap.
Roger, you might ask the Gardaí to attend to your control, will you, please?
I have request the list, gentlemen.
Super, thanks a lot.
So we decided to call the Gardaí, firstly because the chap's been a bit aggressive with us and we were getting a bit concerned for our own safety, and secondly to try and help convince this chap to go to hospital.
So we'll just leave him on for a minute. Just watch him until you see where he goes. Yeah.
Obviously, when the guards would arrive, we would be telling them of our concern for the gentleman, and that we felt that he really should be in the hospital. It would be the right place for him to be, that the chances are he was going to be found again later, and that he would have stopped breathing.
If your heroin lasts longer than that, you're going to drop again. Do you understand? You weren't breathing properly, yeah?
The main goal with us is that we go home well at the end of the day as well. I certainly don't want to be getting blood tests because some chap has splattered blood in my face or into my mouth or in my eye or something. When you go clear on a job, your mind has to be clear from it, because the next job you can go to is another job, and you have to be focused on the next job. You can't be thinking about the job that you've just been on the whole day long, or even if it's somebody aggressive with you, that's just it, that's that job. You just got to get over it and get on and drive on with it.
And he was actually got again that evening, where he had stopped breathing, and another crew brought him into hospital.
One of the problems that we have sort of come across within the ambulance service for many, many years, and thankfully throughout the last few years we've brought on board treatment for is heroin overdoses.
I remember starting and we hardly even knew what heroin was, but definitely in the last few years it's become more available and seems to be the drug of choice for a lot of people at the moment.
An awful lot of the drugs and drug abuse we wouldn't meet because it doesn't have a direct effect on somebody straight away. It has longer term effects on people, but heroin is one of those drugs that it does have kind of an immediate effect on people.
It's an opiate, and the problems with opiates is that if you take too much of it, it affects parts of the brain that make you breathe. So therefore it's a respiratory depressant.
At the moment, because the heroin is so pure, what's happening is they're taking the same doses they would have taken last year, which wouldn't have stopped their heart and stopped them breathing. This year, it's stopping them breathing. So they're now going into respiratory arrest and then sometimes into cardiac arrest because of the fact that they're taking so much of the heroin.
The next thing from cardiac arrest is death. So we had a call for an overdose, and as we travelled to the scene, we were informed that it was a heroin overdose and that the patient possibly wasn't breathing.
Ambulance control to voice number 22, just be aware that apartment is on the top floor. The patient was at the top of the stairs there. The door is already open, and the person that has made the call has left the scene there. We're getting the guards up there, which is well.
Roger that. Do we know if the patient's breathing or?
Yeah, according to the call, the patient is breathing, but he's actually unconscious at the moment. He is breathing.
Roger, door's open.
Normally when we arrive to SIMS, there's going to be somebody there to flag us down, make us aware this is where you have to go. But obviously the problem here was that the person that made the call didn't want to be there, and this is a common problem with heroin overdose, that friends of the person that has overdosed, they're willing to gain help and access help for their friend or for their family member, whoever it may be, but they're not too quick to hang around and ensure that the help gets to them.
Would it be by any chance in the next bit, no?
No, I see a number there.
In this case, the person was standing at a distance where they could see us, and they realised that we were having difficulty finding this patient. And they realised that the longer we didn't get to that patient, the more risk that patient had of dying. So they brought themselves forward and indicated as to where the patient was.
Is he breathing, do you know? He is breathing. Coming out.
This one?
Yeah. Top floor apparently.
We had the apartment number, went into the building and up 4 or 5 flights of stairs and found that the apartment door of the address we were given, that the door was wedged open.
We entered an apartment, very small apartment, very tight, to find a patient on his back and didn't appear to be breathing.
He had a breathing rate of 4 breaths per minute at the time, which is inadequate.
A quick assessment told us that he did have a pulse, meaning that his heart was still doing its job, but he wasn't able to breathe for himself. We began giving him oxygen through a BVM, a bag valve mask, so we were forcing air into him as if he was breathing. And in the meantime, my colleague drew up the antidote, as such, called naloxone, or Narcan it's also known as. We can give it in different ways. We can give it intramuscularly, meaning that we jab it straight into a muscle in the body it has a slow effect. We can give it intravenously, meaning straight into the bloodstream, which has a very fast effect. And coming on stream, hopefully soon, is intranasal, meaning it's a spray up the nose, up the nostrils. The joy of that means that there's no needles involved.
We administered naloxone to the patient intramuscularly in the arm, and the patient pretty much straight away came around and set up and started talking to us.
Do you know what day of the week it is? What is it? Monday, yeah, you're dead right.
This was a positive for us, but again, a negative to the point that he now is conscious enough to start telling us to get out.
So what we gave you as a medication to stop what was happening to you, right, that can wear off. And if there's more heroin in your system...
I'm for heroin and you're wearing off.
Yeah, but you were dying.
I wasn't dying.
Trust us, we don't give the medication to people just for the hell of it. We only give it to you if there's a risk of you dying and you weren't breathing.
They don't believe you. The first thing is they push you off them and they say, well, what are you doing? Get off me, you know, and you're saying, well, you weren't breathing. And they actually don't believe you that they weren't breathing. They haven't clicked that if they take this, it's an opioid and it's going to stop them breathing.
If you do sort of bring someone around, you need to sort of give them a bit of space should they be angry when they come around. This guy was actually okay. He understood that he needed to be helped and was grand, except for the fact that when we then suggested he needed to go to hospital, it was very much a case of, no, I'm fine, I'll be grand.
Right, keep that arm straight, we'll just take your blood pressure again, good man.
Obviously we explained that we were the ambulance service and that he hadn't been breathing prior to our arrival, which he was totally couldn't believe what we were saying, but he actually took it quite well and became quite apologetic in the end as well once he started to realise why we were there and what we had done for him.
The issue we then had was we had to stay on scene for an excessive amount of time to make sure that the heroin that was in his system didn't take over, because he technically didn't need another dose of naloxone or Narcan because he was conscious. However, had we have just taken his word that he was fine, left the house, left him alone, and then found that he later then returned into a stage of respiratory arrest and nobody there to contact help, he'd have possibly died.
For the most part, as is the case with this patient, he refused to attend the emergency department with us and chose to stay at home, which was his right.
So we cleared from that call as in we decided the patient wasn't travelling to hospital, returned to our vehicle, put our equipment away and made control aware that the patient wasn't travelling to hospital and that we were clear and available for another call.
And it just so happened that on this occasion, within I'd say 2 minutes of us leaving this scene, we were dispatched again to the same area to another call which we were given as a cardiac arrest.
So we proceeded to head for that location, and then control come back to follow up that it was a cardiac arrest secondary to heroin overdose. So this was the second heroin overdose call we were attending in the space of sort of an hour and a half, thereabouts.
What's the rest rate now at the minute?
4.
4?
Yep.
Good man, sit up there for us.
The house was full of family members and the patient was on the sitting room floor, and the two of the family members were attempting to do CPR on the patient.
Do we know how much he took? Who was here? Anybody?
I came in and found him on the ground.
Okay, is there any needles around?
There was one syringe.
There was one syringe. You didn't see if there was anything left in it, did you?
No.
You didn't? Okay.
This gentleman had obviously taken either a higher dose or had been down for longer, because the effects of our reversal drug, naloxone, didn't have much of an effect on the first dose. So we continued to oxygenate him with our bag valve mask, and after a period of time had passed, we gave him a second dose of naloxone. And once the second dose had gone in, he started to come around.
Come on.
Oh, there, mate.
We're on here, babe.
We continued to oxygenate him, and he got another dose of naloxone, getting 3 in total. And he eventually came around.
Good man, sit up for us, will you? Top of my bag there, it is open, just a vomit bag. The bag's just there, don't worry.
Come on, sweetheart. All right.
There was a lot of family members in the house as well, who also pleaded with the patient on this occasion to come to hospital with us, because obviously they were quite upset and there was a lot of anxiety in the house because of what they thought had happened to the patient. But again, the patient, once he did come round, decided that he would stay at home.
Well, you're not grand. You see, this is the thing, you weren't breathing when we arrived, so you're minutes away from being dead. That's being blunt about it. Look at me. We don't bring people to hospital for the crack, right? Look at me. You were lucky this time that we were close. Next time you might not be.
The emotions of his daughter and his partner were quite apparent. The fact that they were worried that if we left this gentleman there, they were going to end up with him again on the floor doing CPR and worrying that he was dead. So I mean, that enough from an emotional point of view should have been enough of a motivator for him to say, right, yeah, I'll go to hospital. But he point blank refused.
I tell you, actually, can we just have 1 minute just by myself, if you don't mind? Yeah. I understand you're our family and friends.
Sometimes we might be considered to be very blunt with how we talk to our patients. Maybe a little bit too direct, but sometimes that's what you need. And in this case, I was very direct with the patient.
My name's Andy, right? I did introduce myself when you came in, but you didn't hear me, okay? The reason you didn't hear me was because you were dead. I'm not being mean to you. I genuinely amn't. Now, my genuine opinion at the minute is that you're already starting to dip off already. Do you not feel it? Your eyes are starting to go pinpoint again. So we can't leave you like this.
We got to him quick that time, but next time there might not be an ambulance available to come as quick. And you may die in front of your family, the family that tried their best to get you to go to hospital. So it's all about bargaining and, you know, making sure that the patient realises.
Listen to me. You're going to end up on the deck. Now, you don't realise what else is going to happen? We're going to have to stay here. We do. We have to stay here for at least another half an hour to make sure the medication wears off. The other problem with that is why we're here, we can't go and help anybody else.
The fact is, you know, when the patient is fully with it, they have the right to refuse to come with us. And the best thing that we can do is to tell them that if at any time they change their mind, or if at any time their condition gets worse, that they're always free to call us back, because we are available 24 hours a day, 7 days a week. So every time they call, we will turn up.
We try and educate them, and we try and tell them, look, you know it's 100% pure. You know if you take this amount, you're going to stop breathing, you know. If you do this and there's no one around, you're going to die. The shock factor still doesn't sink in with them. And following day, even that evening, our colleagues on the night shift will probably have them as well. Heroin is a nasty mistress, and unfortunately, she claims her victims slowly, but she claims them, you know. And sometimes we're not there fast enough.
Every year, the National Ambulance Service receives and responds to almost 300,000 calls for help. With 2 central command and control centres in Dublin and Donegal, 999 emergency call takers and dispatchers are the first response in a crisis situation.
Ambulance emergency. I work for the National Ambulance Service in the control centre, and I take 999 calls, so anyone who's in distress or needs help, basically I'm the first point of contact they get through to.
Ambulance emergency. Well, I started the job in June 2014. I always try and get to work about half an hour early, because you have to get set up and then sign in, and then that's it, just jump straight in. There's no waiting around.
Thank you, operator. Hello, caller, you're through to the ambulance service. Just repeat your phone number for me, please. Hello, I'm with the service. 2 years this January, actually. 2-year anniversary this January. Looking forward to a couple more years with them.
Ambulance emergency. When somebody rings in 999, it can be thought by the person that they're ringing somebody local. I have people think that I'm actually in the ambulance coming to them, which is not the case. Control is centralised now, and it means that they could be ringing anywhere in the country, and they're ringing through to Dublin or Ballyshannon.
Caller, you're through to the ambulance service. Can you repeat your phone number, please? When someone rings 999, they get through to an operator, and that operator will ask the caller what service they require, whether it be the fire service, the ambulance service, or the Gardaí. If they require an ambulance, they get put through to us.
We're their first point of contact for getting help.
It can be anything, absolutely anything.
Was there another car involved, or was it just the one car? Okay, are there chemicals or other hazards involved? You really don't know what you're going to get when you pick up the phone. It could be anything from someone who's had a fall, to someone in cardiac arrest, to a child in respiratory arrest.
Will you tell him the address has changed in Monkstown?
From our side, what we need to do is we need to clarify and make sure we have the correct phone number. We get the person to repeat their phone number for us, and then we get an address off them.
Okay, just hold the line, ma'am, while I get your address on the system, okay? The reason why we need to confirm phone numbers and addresses is we could lose contact with the caller. We need to be able to ring them back.
Yeah, I'm trying to ring them back. He was shouting in the background saying he's going to cut our face, so... Or if they have an alternative phone number, I need to take that. And then I need to take the address and make sure they verify it as well.
Okay, just for our records, just repeat that address for me once more. Some callers can be very, very difficult to get that information off. There's a loved one in trouble. They're panicked. They can't remember their own name.
Okay, no, that's grand. You just keep her warm with the duvet till they get there, okay? It's our responsibility to keep the caller calm as they can be in emergency situations so that they can give us the details we need.
Okay, calm down there now, because I need to know exactly where you are before I send you an ambulance, all right? There's no point in us, someone ringing and screaming, I need an ambulance, I want it now. They want it to drop out of the sky. But there's no point in me to send out an ambulance and it doesn't know where it's going.
Okay, is that a townland, is that a house name? There can be a number of Pinewood Groves in Dublin or in Cork or in whatever county they happen to be ringing from. We need to narrow it down, we need to make absolutely sure that where the ambulance is going is where the ambulance is needed. Okay, I know this is very difficult for you, ma'am, but we're going to give them the best opportunities we can, okay? Once people know that you're actually trying to help them, 99% of them will calm down. And after experience, after, sitting down, taking 40, 50 calls each day, a number of shifts a week, you get very good at controlling phone calls. You develop a skill and knack at doing it.
Castleblaine, yeah, okay. Stay in line with me here now. I'm just bringing this up on the system here now. What happens next then, as soon as that address is confirmed, it actually pinpoints that on a map on a screen for me. While this is happening, the dispatcher who is opposite me, this is going live across to their screen. So they can see what's happening, and they, even while I'm confirming the address, they're already looking to see where the nearest ambulance is to this address.
Control 5 Lima 3-1, 3-car RTA, one patient at the moment, over.
Before we even ask the first question, an ambulance or help, whether it be a response car, whether it be a first responder that lives around the corner from the patient, somebody's on the way after 90 seconds.
No problem. I just need to ask you a few very quick questions, okay? It won't delay help coming to you. Are you with the patient now? Once I've got those details, we go into a specific questioning program.
Okay, are there any obvious injuries? His back, okay. Is there any serious bleeding? As someone who's in an emergency situation, answering questions mightn't seem like their priority, but answering these questions is really important as part of our job so that we can get the best help to the patient.
Okay, is he awake? Okay, he's breathing? Okay, was this accidental or intentional? You need to know, how many people is involved, their ages, are they awake, are they breathing? Might seem very normal stuff, but it's massively important. Just reassure him help has been arranged, okay? Don't let him have anything to eat or drink, it might make him sick or cause problems for the doctor. Okay, get him to rest in a comfortable position and wait for help to arrive. What I think a lot of people don't realise when they ring in is that we can actually do a lot over the phone to help. They think that the first line of help is going to be the ambulance arriving on scene to them, but it's not. We as call takers can actually help them over the phone to help that patient.
What I need you to do is make sure your husband's lying flat on his back, okay? Okay, and remove any pillows. Have you done that? We'll stay on the line with the patient depending on the level of the incident, and we will give them medical advice as to how to look after the patient until the ambulance crew actually get there.
If there is a defibrillator available, send someone to get it now in case we need it later, okay? I'm talking people through cardiac arrests over the phone, talking them through CPR and what to do.
Okay, and the guards are with you, yeah? That's grand. Listen, we've help on the way. If anything changes before they arrive, call us straight back, okay? We'll tell them how to control bleeding, whether it's giving aspirin to someone with chest pain. There's a lot of different scenarios that we'll run through with the caller and stay on the line with them until help arrives. So it's really, really important that us as call takers keep the callers calm as much as they can while they're dealing with an emergency situation.
Well, it has its ups and downs, of course, but at the same time, If someone has a defibrillator on scene, or if someone's performing CPR correctly, well then you can always help, you can bring someone back to life, in a sense, you know. And that can be very rewarding. You can take that home with you at the end of the day and say, I helped someone today.
The National Ambulance Service deals with a vast array of types of calls. It's not all blue lights and sirens and flying through the traffic. We got a call to a pet care store, and the call came in as a lady bitten by dog.
When we got the call, it was just for a dog bite, so we didn't know what we were going to deal with. We thought maybe it was a vicious dog in a neighbourhood, but when we got there, the lady was actually dog grooming the dog.
And the dog had turned and bitten her. And when we asked where she'd been bitten, he said on the lip.
You took the chunk out of your lip, and okay. We had it on the tape. So the only blood that's lost is what's on the towel? Yes. Okay, and it seems to have stopped bleeding, doesn't it? Yeah. Thanks. Don't make me smile. The lady was lovely, she dealt with it very well. She was in a lot of pain, but we tried to keep her talking and keep her laughing and try and distract her from the pain a little bit.
So we just give it a little bit of water, that's all it is.
She was fine, otherwise she hadn't lost much blood. It wasn't too deep, it just had taken a good layer of skin off her lip. And the most surprising thing of all was that she felt more for the poor animal.
You're a true dog lover when you're putting up for the dog.
Absolutely. No, it wasn't his fault. She didn't blame the dog at all. She just said that he was scared, he was nervous. She had a blow dryer on him, and she obviously loves dogs a lot, so she didn't blame the dog on biting her at all.
That's because the job she does, she's compassionate for the dog, which is the job we do. We're compassionate for human beings.
This is the thing now, you have a bit of hair stuck in it, right? And before it starts clapping.
One of my other colleagues that was on scene with us returned to the store, to the area where the lady had been working, and managed to actually find the piece of lip that the dog had bitten off.
Best thing to do is to keep it clean. You never know what you can do.
Yeah.
Yeah, absolutely.
Sure, why not? It's your lip.
Yeah.
You might as well keep it. When there's a body part involved that has become detached from the body, we always try and bring it to the hospital with us.
If they decide they want to repair your lip, rather than taking a piece of skin from anywhere else, you might be able to use that, believe it or not. Genuine.
Just keep the pad up to the lip, baby, yeah.
Tell you what we'll do, we'll use this little zip bag.
Now, unfortunately, the lip wasn't able to be sewn back on, but it was a tiny little piece. But it's still important that we always try and retrieve these body parts, if you like.
Now, get rid of that off your finger.
Thank you.
You can take them one at a time or all together. Just a little bottle of just water, okay?
We just cleaned the wound, made sure that the bleeding had stopped, gave her some pain relief, and brought her to the hospital to get checked for, obviously, diseases, anything like that the dog might have.
She was in good spirits as such, barred a little bit of pain and the loss of a bit of a lip. You know, we were explaining to her that it's probably the adrenaline that's keeping her going. And the thing with it is, when we have somebody who has an injury, be it a major one or a minor one, if we feel we can keep them in a jovial form, not that it's all about a laugh and a joke, but if you can keep somebody in up spirits, it just keeps their mind off the fact that they have got something that has disrupted their day, or in the way of a medical complaint or a traumatic event.
Do you want me to get rid of that towel for you? Do you want me to join? Yeah, no problem. The lady herself was in great spirits by the time we reached the hospital, and was almost pain-free by the time we reached the hospital as well, so it was a good turnout at the end of the day.
Sometimes you get a reaction from patients as to, do you know who you look like?
Everyone kind of calls him Gordon Ramsay, as in that he looks like him.
Oh yes, Gordon Ramsay.
Oh no! Seemingly, I have a resemblance to Gordon Ramsay, the chef.
And I've always said if I got €1 for every patient that we go to that has said it, I'd be after leaving the job. By now I'd be a millionaire.
25 minutes, oven 200 degrees.
I suppose we've both been on telly, we both give out too much, and we're both quite handsome, so it's probably correct.
From time to time he'd get out the old pots and pans and the spoons and the whole lot, you know, and give a few roars in the kitchen and what have you, and you know, so he actually does emulate him from time to time. Not often, mind, but from time to time.
Eat quick while you can. Dinner's ambulance service style. Reheated and reheated.
I like to throw it together, you know, just food quickly, and you're always trying to look for food that we can do quick here in the station. It's a Greek dish, gyros. It's a Greek dish. Normally I'd eat ratatouille, so the last few times we've been on it, we've been eating ratatouille. It was a French dish. Things like ratatouille and things, just chuck it together. It's just vegetables and a bit of a sauce and do them together and try and eat some way healthy. I got the ratatouille yesterday, right?
If I hear him talking about ratatouille anymore, I'm absolutely going to kill him.
I always wanted to taste ratatouille. Yeah. It's meant to be a peasant's dish from France. Because it was made with all the odd ends of stuff.
I was left.
So, and put into like a stew.
He's been on about it for ages, and he decided that he wanted to try it. And that wasn't enough. He had to look up the history of it.
But it's actually lovely, like.
Yeah.
So, like, it's all lots of vegetables. So if I can get the little people to be that, like,
yeah,
you know,
especially with film. I've had enough of ratatouille now, and I want to hear about it no more.
In our job, yeah, it can be hard at times to get meals and eat properly and things like that. A lot of times you'll be getting fast food and things because it's quick and it's easy to do. So it's nice to be able to make something quickly and have a proper meal rather than just eating stuff on the way, you know, chips and baguettes and all that. And actually, you know, it's a good icebreaker in one way when you go to a patient and they say to you, or their relative says to you, Jenny, you look an awful lot like Gordon Ramsay. And I usually say to him, why was I just giving out or something? You know, sorry about that. But it's a good icebreaker at times. And sure, he's lucky to look like somebody so handsome as me. Anytime I put pan to oven, we tend to get a call, so the lads don't like when I put pans to ovens. I get given out to. Hello. Yeah. A job. So we'd have a lot of people we kind of see on a regular basis.
Some of them would have fairly serious conditions because of alcohol abuse for many, many years. They would have anything from cardiac issues, liver issues. One gentleman has a bowel issue that needs and requires permanent management. So inevitably, we will meet him every couple of weeks.
We got a call to a gentleman on the street who was bleeding from his abdomen.
We kind of knew from the area who it was going to be even as we were going on the call.
Yeah.
You'd pull up and you'd actually know their first names, and sometimes you'd even know their date of birth and their medical history. You don't even have to ask a lot of the times.
Oh yeah. Good, you're having a bit of hassle?
He's a gentleman that's homeless. He lives in some of the homeless shelters from time to time, if he can get accommodation there.
How are you feeling?
Weak.
A bit weak, yeah. Sort it all out for you once we get in there, okay? We'll take a proper look at it in the ambulance. Yeah.
He has a colostomy bag, and the colostomy bag tends to bleed if he doesn't take care of it.
The drink? You're at the drink a while now, I'd say, yeah?
Years.
Years? Okay. It hasn't bled this much in a while, is it?
He's a chap, he's a bit of alcoholism and kind of some social issues, and he's getting kind of elderly and he doesn't take care of himself. And he's, whether it's that he doesn't care about whether he takes care of his colostomy, or maybe he's, like he hasn't the ability to take care of it properly himself, maybe. But we'd be called out to him quite regularly.
We'll just stand you up and we'll sit you down on the bed.
Up we get.
We'll have a proper look because I can't see it where the bed is.
He had had surgery previously in the last few months, but his surgery kept opening and bleeding.
The colostomy has actually swollen, and his bowel has prolapsed, and literally the bag has broken, and he has exposed bowel. and he's bleeding quite a lot, and he would have lost a lot of blood.
Hygiene wouldn't be the greatest, so there's probably infection setting in and not giving the wounds a chance to heal.
He would have been drinking that day, probably quite heavily, and probably for a couple of days prior to that point. So he'd be quite inebriated, and because of the blood loss, very, very groggy as well.
He's like one of these categories of people. He kind of, you know, falls into who's responsible, or is it he's responsible, or is it who's responsible to try and help him. So we tend to get called to these chaps an awful lot.
We're off the street now, okay? We'll see what we're at and where we're at, yeah?
You have to basically manage the bowling as best you can, because we don't carry colostomy bags. It's not within our parameters. So basically what you're left with in that option is keeping the bowl as moist as possible. So that's what we call gamgee, which is surgical pads. We wet them with surgical water, sterile water, pack it around the bowl.
What we did was we dressed it as best we could, try and control the hemorrhage, and we actually had to press quite hard on his tummy to try and control the hemorrhage. He was bleeding that much and his blood pressure had gone quite low.
We're going to cut everything off you. We're going to put a hospital going on you, alright? Okay, we get you some new clothes down the Mercy, alright? Okay? Alright, because we need to get rid of all the blood in these clothes, okay? They're really soaked in blood. You must have been bleeding away for a good while.
We had to cut off his clothes and just check the wounds and things and make sure we're not missing something, missing another wound somewhere that we mightn't see initially. You can get distracted by focusing on one area. Maybe you might miss something in another area. So we cut off his clothes, applied some clean dressings to the wound, tried to control the bleeding and get him down to the accident emergency and get him seen quite quickly.
Yeah, I'll do it there in a minute as well, maybe.
Some people can get frustrated with these calls. Oh no, not down to this chap again, he's wasting our time, he could be holding us up, and what if an ambulance is needed somewhere else? That's kind of not the attitude I have. I have the attitude that, well look, you know, that kind of work is always going to be there. You can get frustrated with it, or you can just get on with it.
When's the last time you were in the Mercy?
We have to understand these people are people, and you deal with them as people. They could be one of my family in time, or they could be, and they are somebody's family, so we should have a bit of compassion for them and just get on with the work we're asked to do at the time.
You don't mind if I press on that tummy as we're on the way in?
When you're a new medic, you try and save everybody and you try and get them off the booze, and you know, they've been drinking for probably longer than you've been on the earth, and you know, you try and counsel them as best you can, but it doesn't work. This is their life. This is what they do.
Alright. Sorry, no.
We brought him into the accident and emergency department, and we brought him into what we call a resuscitation room. It's a section if we call ahead and say we have something kind of that's either a bit unusual or a bit serious. We'll call ahead to the accident and emergency departments and let them know we're on the way in and how long we're going to be, so that they can be prepared for what we actually bring in at the time.
Hello. We took him to the hospital that day. He was patched up, dressings applied, discharged the following day, and I think we got him again 2 days later with the same problem again. He'd gone on a drinking spree, wasn't looking after the wounds, left them get wet and dirty. I suppose it's a never-ending circle.
We've had a lot of chaps that we've seen, like where they've started on alcoholism or they've become homeless and things like that, right up to when they die.
Us and the Gardaí are the only ones that realise when they're not there anymore. You know, we know them, we see them every single day, we drive round, we see them every single night. And, you know, every now and then it's a case of, you know, you'd meet the guards on a call and you'd say, listen, have you seen Mickey around lately? You know, what's the story? And then you find out Mickey died, you know, or Jack died, or Jim died, or, you know, and it's a case of we're the only ones that miss them. They're forgotten people.
You can actually see how they get worse and worse and worse, and you can see them deteriorating basically from call to call.
After a while, when you work in an urban setting, they know you and you know them because you've seen them so many times, and they say to you, yeah, I know, you told me last time if you saw me drinking again, you kicked my ass, but you know, I had to drink this time because, and they'll give you a story, and you know, you just sit back and smile because, you know, this is their life. And you know, as long as you'll be working, you'll meet these people, you know. And it's really sad.
RTCs can be very difficult for people.
Just try and relax. You're going to be okay.
The engine is back up into the dashboard. The people in both cars are very lucky to be alive.